Well, we're live, and welcome to Integrated Health of Indiana's 7 o'clock talk. And tonight we're going to talk about the transportation node. And I will share my screen here. And we are going to actually talk about transport. And if you look, when we were in the teaching matrix, it's talking about the cardiovascular and the lymph system. Of course, the center of the matrix is mental, emotional, and spiritual. But, oh goodness, let me ask Jess here. Do we have a problem in the Midwest with cardiovascular issues?
Oh, yeah.
How common is
Second to diabetes.
And with that, what are some indicators that people should know for cardiovascular issues from the hospital side?
Like what their symptoms would be?
Yeah.
High blood pressure, weakness, fatigue, swelling.
All kinds of fun stuff. And so if the definition for diagnosis on this is actually we'll go to the Mayo Clinic. And so for diagnosis, you have to have any three of these five things: a large waist. And if you are American, if you're male, it's a waist of greater than 40 inches. And if you're female, it's a waist greater than 35 inches. If you have a high triglyceride level, so if your triglycerides are over 150, that's a second indicator that you are working on, if you want to call it metabolic syndrome, syndrome X, insulin resistance, prediabetes. All of those are actually pretty synonymous. If your good HDL is less than 50 milligrams per deciliter in women, if it's less than 40 milligrams per deciliter in men. And we already discussed the blood pressure, and now it's either greater than 130 or greater than 85. So those are actually two different things. And then an elevated fasting blood sugar of 100 milligrams per deciliter. And that immediately qualifies you to be diagnosed as metabolic syndrome. And the problem with this is typically when we have metabolic syndrome, the first thing that we start to notice on that is high insulin levels. And your fasting insulin is what goes high. And that creates all kinds of problems in your body. High insulin is another thing that causes you to get atherosclerotic plaques. It makes these small, dense LDLs they grow. And so when you have that happening, you increase the incidence of plaquing. The other things, insulin causes an increase in estrogen, especially in men. It'll start to do what is called aromatase. So if you know guys that have large bellies and man boobs, those are your indicators that you're probably taking your testosterone and aromatizing the testosterone into estrogen if you're a male. And if you're female, that estrogen gets raised. And this is why high insulin levels are a risk factor for breast cancers. What else? When we're looking at metabolic syndrome and we think about all of our people, and we're looking at insulin, homocysteine, some of the things, what are some of the things to help offset? So a vegetarian vegan diet does help offset. That's actually what I am now experimenting with for my own hyperlipidemia. I actually can be diagnosed with familial hypercholesterolemia. And so that's been very interesting because my LDL shot up to 190. So I am now playing with, well, Jess is along for the ride. We're now playing with a vegan vegetarian diet to see how that does. And I'm addressing my hypothyroidism.
I'm down with it because I don't really care for meat. I
Yeah.
have to take it or leave it.
You've never really cared for meat.
No. What else can you do for it?
Yeah.
Exercise,
That's a big
diet,
one.
Relaxation, stress level, reduce the stress.
Yep. And so she hit one of the largest things there when you're looking at modifiable lifestyle factors. So if we go back to the matrix and we start to look at modifiable lifestyle factors, you can see the 5 pillars down here. And exercise and movement is its own thing. If they could bottle exercise and they could bottle how that makes the muscles their own independent glucose sink, that would be a blockbuster drug that would kill all other blockbuster drugs, including the statins, which are a multi-billion-dollar industry. But one of the other things that I want you to see here on this transport is it says cardiovascular and lymphatic system. So people don't think about the lymphatic system, but the lymph system is, how would you explain the lymph system? I mean, I know how I want to explain it in doctor speak, but how would you explain the lymph system so that people understand?
Well, the lymphatic system runs right next to your veins and arteries. However, it doesn't work on the same. There's not a pump. So nothing pumps the lymphatic system like your heart pumps your arteries. It's a valve. So it's massage basically brings it back. So you have to move. If you don't move, you just let the lymph sit. So that's why people have to get up and walk. That's why people that have problems with their lymphatic system has all that pooling in their legs. So the massaging, basically your muscles moving because you're moving, massages that lymph back to
the center of the body.
Yeah.
And that's,
but it's a big immune, got lots of immune properties in it.
It takes away a lot of the stuff that's in your body. So things that get cleaned out go to the lymph system. And then, like she said, it
eats up cancers, your lymph system. So your part of your lymph system is your tonsils.
Lymph nodes, yep.
But your tonsils are a big one that people think you don't need, but they do have a purpose. So they're always cleaning things out. People that get swollen lymph, the tonsils,
tonsillar stones,
it usually is because they're cleaning. They're like, they just clean up junk.
So if you look in your mouth and you look back in the back and you see your tonsils, and then you see little white things on them, those are called tonsillar stones. And that is lymph that is matted. And if you've ever had these things, they are foul smelling.
If you see those on a report, they're actually called tonsillar lithiasis.
Oh, really?
That's the name of it.
Didn't know that. So that is what happens when those muscles squeeze. It goes up, catches a valve until the next squeeze goes up, catches a valve. So some things to help your cardiovascular system and your lymph system. What's one of the things we try to do at least once a month?
Oh, well, massage. But like if you're one of the best things you can do for yourself if you don't go get a massage is a dry brushing. Take a dry brush and you dry brush from your toes and your fingertips to your core, and then you brush up your torso and you warm water. You can do that after your shower, but massage yourself. But dry brushing is amazing to move lymph around your system.
And drink lots of water, and preferably water that has electrolytes in it as well. And so when you're doing that and you're working, so massage is fabulous for this. And especially if you have trigger points, a good massage therapist will find those trigger points and work those out. And then whenever we come out of the massage place, they're always giving us water, and we'll always stop and get big bottles of water, because that is needed for the lymph system and everything to keep flushing. And you're mostly water.
Yeah, and if you don't flush it out, that toxins get reabsorbed back to the body.
Also, your blood needs water. If you're not drinking enough water and you get your blood drawn, what's it look like besides garbage?
Oh, it'll be thick, dark. Well, it's just thicker.
So the blood is physically thicker. I mean, and you look at it and it's typically dark.
And they'll have a hard time getting it. Usually if you're dehydrated and you don't have really good veins.
So exercise, things to help the transport node. And this helps you overall. Plus, if you're helping the transport node, you're automatically helping the structural node. You're helping the communication node, because your body needs all of these different components and they're all intertwined. So when you start to make sure, so as a rule of thumb, drink half your body weight in ounces.
At least.
And if you are obese and really large, and we have some people that are that way, so if you're coming in at 350 pounds and you're 5 foot tall, drink half your body weight that you should be in ounces. And that way you can start to get that water in, flush things out, try to do what movement you can. But you got to be careful, because if you're that out of shape, if you start working out, the problem is you'll start to get sore. You'll produce a lot of lactic acid. And once again, the water is needed for that to move it. The lymph needs to move through mild movement and exercise and massage. And so, that's kind of the transport node, but it's kind of a secondary. It's like a Johnny come lately. By the time we know that you have cardiovascular and lymph issues, there's a lot of other parts of the matrix that typically have already gone wrong, like your assimilation node and your hormones and stuff like that. So, we don't want to see, I'll pull mine up. What we don't want to see on a matrix, when we look at somebody's matrix, got to add that to the stream. When we see somebody's matrix, here are the nodes: structural, assimilation, defense and repair, energy, biotransformation. Here's transport. Here's communication. We don't want to see big points here, because as we said, if you have a lot going on in transport, you have lymph problems, you have cardiovascular issues, and you're coming to the table really, really late, and we have got a lot of work to do.
Well, usually if you have a lymph issue, there's no cure for it. So people that get lymphedema, they will usually always have lymphedema, and they can manage it with like compression. But once there's damage, you can't really fix it. So like especially people that's had surgeries and they've had cancers and they've had radiation where they've had their lymph nodes removed, and they have a lot of times women get breast cancer, so they get their lymph nodes removed out of their axillary, which is your armpit area, and then they have problems with their arm swelling. So you can't really fix that. You can manage it with compression and massage.
So you can help it, but then, like we talk about with our patients, if you think about living, and this is a very simplistic view, but every trip around the sun is a year. And the way I explain it to patients is once we start to get so old, you think of a person with a backpack on and they're walking around a track. And every time they walk around a track, we put a brick in there. So every year we're adding a brick. There comes a point in time when the machinery is maxed out and it's going to do what it does as well as it does. Now our job is to go in and remove as many bricks as we can so that the machinery can catch up, do its job, and then the person can live a comfortable, productive life. And that's kind of what it's all about. And that does require sometimes giving up some of the things that we thought were good for us that actually aren't. I mean, there's the debate around alcohol, and 5 years ago, 10 years ago, I would have said, hey, alcohol, a good hearty beer, relaxes you and it's got lots of B vitamins and stuff like that. But now the studies on alcohol just show that it sterilizes the gut. And the other part of that issue with alcohol is oh, hey, it relaxes somebody. So it takes their HPA axis down. That's great in theory, but what we're finding out is the damage that is caused is greater than the amount of calmness that it gives. And so there are other ways to relax that will give you more bang for your buck rather than, I can't think of a good analogy, getting a small slap to the face for whatever. I can't think of a good analogy right now on that, but it's alcohol is not a win-win. There is a cost to this.
It's not true relaxation, it's just a sedation.
That's true. Yeah, it's a depressant. So, well, with that being said, if somebody wants to actually answer questions and see how they look on the matrix. So when we start to look at this, if somebody wants to see how they lay out, I really have to update this. I haven't updated this in 2 years now. If somebody wants to have this done, I do this with all my functional medicine patients, and it starts to give us a roadmap. But we can send this out. You guys can, if you look at the ticker, Dr. Miller at Integrated Health of Indiana, we'll send this out to you. You can answer the questions. We can start to see what's going on in here on your matrix. And then we can start to address these issues a piece at a time and get you to feeling better. You all have a wonderful evening. Thank you once again, and we will see you next time.